Hello, I'm Dr. Robert LaLouche, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about breast tenderness. And this is a common complaint that OB/GYNs have, and we'll go over what are the things to be concerned about and what are things that can cause it and what you can do about it. First, let me give you one important point of reassurance. For most cases, breast tenderness is not an indication of breast cancer. We wish it were, because that would make it easier to detect breast cancer. Now, that's not to say there aren't instances of breast cancer where breast tenderness is a component of what's going on. In my experience, most women who have tenderness from the breast cancer have a more advanced form and already know it, or it's quite evident with many other signs, like an abnormal exam, abnormal appearance, abnormal mammogram, all of these abnormal things. But just breast tenderness all by itself with nothing else, very rare for that to be the only sign of breast cancer. I have other videos on the breast cancer risks and discussions about that, but let's talk about some of the common things that can cause breast tenderness. Well, excessive caffeine can cause breast tenderness. So a serving of caffeine is about 35 milligrams of caffeine in an 8-ounce cup of coffee or a diet soft drink, typical unless you're with some of the higher concentration one. So what would be excessive? Well, it depends on your symptoms, but 3-4 a day might start to cause that symptoms. Also, other similar chemicals to caffeine called methylxanthines that are in like dark chocolate can also do that. So if you're having a little tea, you're having some coffee, you have some of the dark chocolate, that might be enough to do that, okay? Also, during your menstrual cycle, there are times where you feel breast tenderness, so hormones can affect it. If you start to take birth control pills for the first time, if you watch that video, I explain why that might be a symptom that you have that causes breast tenderness. Usually in the first month, goes away in a month or two. That, by the way, is also a sign of pregnancy. So one of the most early signs of an early pregnancy is some breast tenderness. Also, your breasts are responsive to hormones. The tissue that will make milk when you're breastfeeding, the glandular tissue, can shrink and grow, and that can cause some tenderness, and so can changes in your weight. Changes in your weight can stretch your skin a little and could potentially affect things, so cause some breast tenderness. There is an herb over the counter called evening primrose oil. It's in capsules. You can get it at most department stores or drugstores that can help with breast tenderness. You also want to know, are you having some nipple leakage from your breast? That's a little different. Is it coming from the tip of your nipple or the areola around? That leakage could potentially be a sign of a hormone imbalance. It could be a sign of infection, and it could also be a sign of potential breast cancer. So leakage, or especially on one side, is something that you need to mention to your physician. Can also be a potential side effect from medicines as well. Variety of different causes and different interventions. Most of the time not a big significant problem, but if it's enough to bother you, you should mention it to your physician. There are things that can be done and it can be looked into, but you can rest assured that most of the time it's not going to be cancer. I hope you found this helpful. Please leave your comments.